They are the heroes in the frontline fight against COVID-19, but in these unprecedented times, healthcare workers need help and support now more than ever. Our Fox 12's Kendra Kent introduces us to a local doctor who's hoping to spark a new conversation about mental health.
As the fight to end COVID-19 wages on, a Portland doctor is launching a battle of her own, bringing mental health care to the forefront of the frontline workers and destroy stigmas that keep doctors and nurses from reaching out for help.
I've lost too many friends at this point and acquaintances to not have that little bit of courage and the hope that that we can all step up.
Dr. Esther Chu is an emergency room doctor at OHSU and also a professor at the university. The last few months have been nothing short of brutal.
I won't lie, it's tough, it's exhausting, and it's just a different challenge than we've ever had to face.
And Dr. Chu says the mental toll is a threat to the entire profession, even in normal times, but especially now.
This has just been going on for a long time. It's very hard to be at the ready for this new emergent disease and trying to figure out how we best treat patients with a lot of changing information and just this sustained anxiety about bringing COVID home to our families.
So Chu penned this op-ed in the Washington Post titled "COVID-19 is pushing doctors to the brink. Medicine needs to realize they're human and need help." She talks about how a job in healthcare is stressful by nature, leaving medical workers at higher risk for anxiety, depression, and suicide. Chu says there never can be enough access to mental health care, but the bigger problem is that doctors and nurses won't use it.
We have such a hard time connecting health workers to those supports because there's such stigma. There's such a culture of you don't show weakness, you don't need care, your patients need care, but you yourself don't need care.
Chu says she found herself in that same boat years ago as a new doctor when she struggled with depression and eventually sought treatment. But she kept her illness from nearly everyone in her life until now.
It was really embarrassing to me. I think part of my identity, especially as an emergency medicine physician, was being this kind of unflappable person.
By speaking out, Chu hopes she can be part of the change to end a stigma that shouldn't exist and help inspire others to reach out.
If we all say something, then maybe that affects one person out there or two people.
Kendra Kent, Fox 12 Oregon.